Good morning. My name is Zach Porterfield. I'm an assistant professor in the Division of Infectious Disease and International Medicine at University of South Florida. We appreciate everyone joining us for another installation of the USF Health International Health Conversation Series. Just as a bit of information, this presentation is being recorded and will subsequently be available for review on YouTube. Please feel free to enter any questions into the chat box and we'll get to them towards the end of the presentation. I'd like to, thank you. We're very pleased to have Dr. Jenna Vallario here today for her discussion of building capacity for audiology training and service delivery in Malawi. Dr. Vallario got her Bachelor of Science, Communication Sciences and Disorders from the University of Florida and her Doctorate of Audiology from the University of South Florida. She's a senior lecturer at African Bible College, Hearing Clinic and Training Center in Lilongwe, Malawi, which is the first hearing clinic in the country and the only degree granting program in the region, with the exception of South Africa. And Dr. Vallario has been a key part of bringing that vision to reality. So we couldn't be more excited to hear some of her stories. And with that, Dr. Vallario, I'd love to turn it over to you.
Let's see. Thank you, Dr. Porterfield. As he said, my name is Jenna Vallario. I am a volunteer audiologist living in Malawi, Africa. I've been with ABC Hearing Clinic and Training Center in Malawi for almost 5 years now. This is my experience working on the ground in a low-income country. Importantly, I want to say this kind of work often takes a village, and I am just a small part of a larger team. A team made up of mostly dedicated Malawians, many of whom have devoted years to serving their communities. I've learned a lot in the last few years, and I know I still have a lot to learn from my Malawian colleagues who are certainly oftentimes much more knowledgeable about hearing healthcare and these ear-related conditions within their own communities. But if I can use my voice to spread awareness about audiology in Malawi and our training program at ABC, and most importantly, open the conversation about humanitarian work and the complexities that come with that, I will certainly jump at every opportunity to do so. So with that being said, thank you for inviting me to be a part of this series. This is a full circle moment for me. I'm a USF Audiology graduate, class of 2019. Shortly after graduation, I moved to Malawi. And I'm jumping the gun a little bit here, but in 2010, I partnered with USF ENT surgeon, Dr. Julia Tolman, for purposes of research collaboration. And I'll get back to that later. But last year, Dr. Tolman, 2 USF audiology doctoral students, and Dr. Porterfield, our moderator on the series, visited us in Malawi. Dr. Porterfield is familiar with our work. He has visited ABC twice now. He's joined us on a week-long outreach trip. He's assisted with published research. He's hosted 2 of our ABC students in Florida, and he's gotten to know many of our staff and students. He is certainly a valued part of this larger team. So before I get started, I just want to share a video that was created by one of our previous sponsors about 5 years ago that gives a really great view into what we do here.
The life of a child with hearing loss in Malawi, it's very challenging. If that child is not able to hear, that means that child won't be able to speak as well. It will be hard for that child to go to the normal schools that we have in Malawi. There are lots of things that cause hearing loss. I'm thinking of cerebral malaria, medications like quinine, HIV/AIDS. Edgar is an 8-year-old boy. He lost his hearing while he was 4 due to cerebral malaria.
And when he got cured, we didn't notice that he has got hearing problems. But at the time when he started schooling, he couldn't hear what the teacher is talking. This is the thing which makes him to fail exams in the art school.
Hear the World Foundation has been supporting the ABC Hearing Clinic since 2011.
Before ABC Hearing Clinic opened, there was no any hearing clinic in Malawi. There was no one to look into these ear problems.
We support them with hearing aids, with equipment, with volunteers. And what I find extremely impressive is how professional the staff is. It's on a par with many clinics in the developed world, and I find this amazing.
So right now we're in Kasungu at St. Andrew's Hospital. We are committed to do those outreaches just to reach out to people who cannot come to visit us in Lilongwe. So we have to go there and I have to give them those services for free. We do otoscopy, tympanometry, diagnostic PTAs, also fit hearing aids and newborn hearing screening. It means a lot to Malawians, to everyone right now.
We started this week with the newborn hearing screening, and this is super exciting because until now the kids come in very late. So at the earliest when they're 2.5, and we're very hopeful that we can catch them early by doing the newborn screening. So it's a big milestone in moving hearing healthcare in Malawi a step further.
Edgar came to our clinic last month and he needed hearing aids.
These hearing aids are very expensive. I couldn't manage to buy them with my own money.
The first time that he was fitted with hearing aids, you could see just he was delighted. He was overwhelmed, he was just full of joy that at last he could hear again.
Exactly, it sounds good.
Edgar is now able to hear properly and he is able to respond quickly.
Malawians are very grateful to Hear the World Foundation.
The clinic is about to be handed over to Malawi clinicians. Till now there were Australian or UK audiologists volunteering here for longer periods of time, but they have now trained a set of extremely skilled local clinicians.
One of the services that we want to do is to train others. We are Malawians. We know the real situation in Malawi. I think we are the people to help Malawians in this field.
That's what we want, sustainability and not having the people dependent on others. Being here at this moment in time is very exciting.
I don't know what I could have done without Hear the World Foundation.
Zikomo Hear the World Foundation.
So ABC Hearing Clinic and Training Center is located in Malawi's capital city of Lilongwe. Malawi is one of the poorest countries in the world with subsistence living and low-value exports. It has undeveloped infrastructure in health, education, transport, you name it. And it is significantly affected by HIV/AIDS and malaria. About 70% of the population is living in extreme poverty, with the yearly average salary in 2013 at about $320, and 10 years later, it's only at about the mid 500s. 30% of the population cannot read or write, and half of its 19 million people are under the age of 18. And, despite all of this, it is widely known as the warm heart of Africa. People here are kind. It's really difficult to put into words the beauty and strength of this country, which is just set against a backdrop of unimaginable poverty. And we know poverty usually goes hand in hand with limited or inaccessible healthcare, and that includes audiology services. So in 2010, Rebecca and Peter Bartlett, who are audiologists from Australia, moved to Malawi for actually reasons unrelated to audiology. They quickly realized there were no hearing services in the entire country, and they started the very long journey of building the first hearing clinic, which opened in 2013, and developing the only audiology degree program in the country. ABC Hearing Clinic and Training Center is a Ministry of Ears Incorporated, which is an organization in Australia, and I'll get back to that later. In 2016, following many rejections and bumps in the road, Medical Council approved the 4-year Bachelor of Science in Audiology degree program. It's 5 years, it has a prerequisite year, but it's a 4-year program. In 2021, we graduated the first group of students in the entire country. That same month, we received full accreditation of the program from the National Council of Higher Education, and in 2023, we graduated our second group of audiology students. As of this year, we have 21 students enrolled in the program. So we operate based on the Ears Inc. STORE framework. So that's services, which is establishing the flagship facility, that would be ABC Hearing Clinic, training, creating structured and intentional programs for local staff and students, that would be our degree program. Outreach services, that would be regular, strategic, and clinical visits to areas without accessible services, which we do quite often. Resources, securing and focusing on personnel, equipment, inventory, facilities, utilities, intellectual property, and partners. I'll get back to the partners later. And evaluation, that's the continuous assessments before, during, and after projects. And this framework is to ensure that our program is effective, it's efficient, responsible, and it has the capacity for growth. So to really understand our hearing clinic and the degree program, it might help to understand the greater ABC framework. So ABC is a US nonprofit with campuses in multiple African countries. Within Malawi, ABC has 3 separate entities. We have an academy, which is a private school for kindergarten through high school. That's the top right picture. A community clinic, which houses the hearing clinic, among other specialty professions, and those are the bottom pictures. And a college, the top left picture. And they're all located on the same campus in the capital, Lilongwe. So audiology is really 2 separate entities under the larger ABC umbrella. We have the Bachelor of Science in Audiology, which is a degree program under the ABC College umbrella. And we have the Hearing Clinic and Training Center, which is a hearing clinic under the ABC Community Clinic umbrella. And although they're 2 separate entities, they often intermingle because the lecturers in the college program are practitioners in the hearing clinic, and all of the college students complete their practical coursework at the clinic as well. So we get to teach the theory and apply the practical all under the same roof. ABC Hearing Clinic is a state-of-the-art facility. We have 2 soundproof booths, one for pediatric assessments. We have 1 room for hearing aid fittings, 1 room for our ear mold lab, and a training room where we teach a lot of our classes. The clinic is currently employing 5 Malawian audiologists, ABC graduates, 2 volunteer audiologists, myself, and an audiologist from the UK, Dr. Lawrence Hill. And we make all of our silicone and acrylic ear molds in-house, which if you are an audiologist watching this, you might know that is quite rare. In the US, we take ear mold impressions and send them to a manufacturer who returns very pretty ear molds back to us. We have a full-time ear mold maker, Robert. You can actually see him pictured there. He's actually deaf, and he's been with us for many years, and he's very, very talented. He makes beautiful ear molds. So our clinical services include comprehensive hearing evaluations for adults and pediatrics, ear canal management, which wax and infections are a massive problem in Malawi. Amplification, we do hearing aids, bone conductor hearing aids, and we can bring someone in for cochlear implants. We do vestibular services, electrophysiology, tinnitus management, newborn hearing screenings, school screenings. We do awareness campaigns in the community and outreach services. So we try to do it all, and we really try to do it well. ABC Hearing Clinic is a private clinic, and people do pay for services. We have to make an income in order to keep our doors open. But we want to serve the community and we want to improve accessibility to those who cannot afford services, which is the majority of the Malawian population. So our clinic is not for profit. So the more foreign aid and funding and revenue produced by the clinic means more resources can be allocated to the outreach side. Our outreach leg travels to the remote areas, and especially the northern region where hearing services are essentially non-existent to the community. These services are free, and amplification and hearing aids are at no cost. In the bottom left picture, you can see our outreach vehicle. It's equipped with 2 soundproof booths, and oftentimes will show up to locations with hundreds of people sitting outside waiting to be seen by the ABC team. So what do we do? What do our services often look like? A lot of ear canal management. We recently did a study in collaboration with USF that was a 3-year case file review. Essentially, we looked at every consultation appointment at ABC Hearing Clinic from 2019 to 2021. And what we found was about 83% of patients had some degree of outer or middle ear pathology. And of those, 53% of patients had occluding wax. So you can imagine there are a lot of people walking around with earplugs in their ears. And these are numbers that you just don't often see in the US. If you ask a Malawian if they've had an ear infection that resulted in a perforation and drainage, most would say yes. And they would just say that is normal. That's a part of childhood. Everyone gets that. And we see so many chronically draining ears on outreach. We go to government hospitals that do not have antibiotics for these patients. ABC brings medication to government hospitals. So many conditions that are treatable if they had access to healthcare services. Another thing we see quite often is hearing loss from malaria, ototoxicity from antimalarials, specifically high doses of quinine is really common. As of 2006, quinine is no longer recommended as a frontline antimalarial, but it remains on the WHO list of essential medicines for treatment of severe malaria when other medicines or drugs are unavailable. And oftentimes, those drugs are unavailable in the remote areas. And we see quite a bit of hearing loss associated with HIV as well. In Malawi, the prevalence rate among adults is about 9% as of 2019. And interestingly, I was taught by my Malawian colleagues not to ask outright if someone has HIV. At ABC, we ask if they take daily medications, ARVs. So we see all kinds of hearing loss with HIV, outer, middle, inner ear loss from opportunistic infections, ototoxic drugs, etc. So to the training program, this is my bread and butter. My primary role at ABC is a college lecturer where I teach courses offered in the Bachelor of Science in Audiology degree program. What really drew me to ABC Hearing Clinic was the sustainability aspect, which is very important in this field. Audiology services are not just a one-stop shop. It requires years and oftentimes lifelong rehabilitation and services. So it was important to me that I worked for an organization that not only recognized this, but prioritized it. So ABC had already laid the foundation for a training program that had really great potential, but was just lacking the personnel to teach the courses. So we are a 5-year degree. We have a 1-year prerequisite general education classes and 4 years of audiology courses. Our curriculum was built in collaboration with the University of Melbourne, and it has extensive theory and practical work. The courses all build up on one another, starting with the foundational anatomy, physiology of the ear, hearing sciences, and they continue all the way up to specialty fields like vestibular and cochlear implant. Our program has gained international traction as we are one of the only audiology degree programs in this region, besides South Africa, that I know of. And we currently have students from Zambia and the Republic of Congo enrolled in our program. But we are still a small program. We only take between 5 to 12 students every 2 years. We have limited facilities, lecturers, clinical supervisors, and resources. For many years, the program just had visiting lecturers that were doing block teaching. So intensive courses that were offered for 2 to 3 weeks at a time, which of course is not ideal for retention of information. We were having to move classes around and teach during holidays to account for these volunteer schedules. And at that time, there were only 1 or 2 college faculty members. This semester, we have 2 Malawian audiologists and 2 expats on the college team. So at ABC, you must hold at least a master's to teach. So after the first group of graduates in 2021, donations funded higher education for a couple of the clinicians. And soon a 3rd Malawian will join the college team as well when he finishes his master's. And so this increase in the number of part-time and full-time faculty has been a significant change in the quality and continuity of courses in the program. Interestingly, when COVID hit, we were forced to teach remotely because school had shut down. It was the first time ABC attempted to do online learning during a pandemic in a low-income country with students who didn't have laptops or Wi-Fi, which, as you can imagine, it was not ideal. What we did learn, though, during this time was that we could recruit experts in the field to teach the courses remotely and not in block mode, but throughout the entire semester, which we had never done before. We had specialty courses that myself and the only other lecturer at that time weren't really equipped to teach. And so we recruited really great experienced professors like USF faculty, Dr. Stephen Surrency and Kelly Teagarden, and Purdue faculty, Dr. Lada Krishnan, who is pictured on the right, just to name a few. And although the pandemic was a tough time for us, we discovered that we can use the online learning platform, and since then have continued to utilize guest lecturers where we now live stream the lecture in a classroom with a projector, and we have faculty on the ground to facilitate the course. So it's been a surprisingly good outcome of a really difficult time. So in 2021, we graduated the first cohort of 10 audiologists in the entire country. This was many, many years in the making. Some of these very, very dedicated students had been at ABC 7, 8, 9 years because of bumps in the road with accreditation, limited faculty, and just issues building a new program in a country that did not acknowledge the field of audiology. And because of limited job opportunities, we've actually lost 4 of those 10 to audiology jobs in the UK, which is brain drain and sad for the country of Malawi, but in my opinion, speaks volumes to the quality of our training. But as of last month, the government has created 6 audiologist jobs in 4 central hospitals, and I'll get back to that later. So in 2023, we had our second group of 8 graduates. One of our students, Ruth and Tamo, was the valedictorian of the entire ABC graduating class. I've been with this group since the beginning of their education, so this was a really proud moment for me. Last October, we celebrated 10 years. We currently have 21 students enrolled in the training program. ABC has employed 5 audiologists from the graduating class of 2021 and 2023. Our doors are open, we're providing services, and we're training the next generation of audiologists in the country. So how did we get here? What did we do right? I personally cannot speak to the tremendous effort to fundraise and build and successfully accredit the training program. I do know it was many, many years of 2 steps forward, 1 step back, and it still is. You really have to have patience and persistence and flexibility in this environment. Nothing goes as planned. I often say you have plan A, plan B, plan C, and you end up at D. And that's normal and to be expected. And you must continue to push on in moments of defeat and setbacks. like the initial rejections for Medical Council and the National Council of Higher Education, and government's resistance to create jobs in central hospitals. And for so many years, we really were just trying to survive. And in my opinion, in the last year or two, specifically for the training program, we really come to a place where we feel a bit more settled. We have full-time and part-time Malawi and expat staff. We've seen successful groups of graduates, and now we're really at a point where we can grow and, most importantly, improve. And you know, certainly we are never guaranteed tomorrow. The hearing clinic and the college program will continue to rely on donations until the country is economically stable and 70% of the population isn't living in extreme poverty. It will never be easy or straightforward. But until then, the more funding we can bring in, grants, sponsorships, partnerships, the more services we can provide in the community, and the more students we can train. Everything we do requires resources, right? So the question is, what is enough funding? What is enough? And we will always be sourcing funds to improve accessibility to services and improve the training program. And sourcing these funds and equipment is a full-time job. As I've said, this is a team effort. We have very dedicated people on the ground and volunteers all over the world contributing in various ways. And we've partnered with organizations both locally and internationally that have helped bring in this necessary funding, equipment, program support, and opportunities for our students and staff. And in my opinion, these partnerships are so important to build up and improve a new program with limited resources. The University of Melbourne were key players in the creation of our curriculum, and partnerships with big organizations like Hear the World Foundation and J&K Wonderland Foundation got us our equipment and hearing aids, among many, many other things. ABC has worked with government to create audiology positions and accredit our program, and I'll get back to all those later. But for the last 3 years, we have worked hand in hand with USF to build a research program. So in 2020, I connected with Dr. Julia Toman. She is an ENT with a passion for global hearing healthcare. I wanted to create a research partnership, one that connected USF audiology students with ABC audiology students. And with only a handful of ear-related studies in the country, there is a massive need for data. Can't say there's a problem unless you prove there's a problem. And so I was keen to build a research program, but as a new grad with limited research experience, I needed help. The idea was USF students who had to complete a doctoral project for graduation would partner with a student here for a mutually beneficial bilateral exchange of ideas for purposes of research publication and program development. And so that started our now 4-year journey with 3 completed projects, one that has already been published and 2 that are currently undergoing the publication process now. It was important to both Dr. Toman and myself that these projects remained in the hands of the Malawians. These projects were designed by Malawians, the data was collected by Malawians, and should be published by Malawians. And so this project, Hearing Health Awareness and the Need for Educational Outreach Amongst Teachers in Malawi, was our first publication. It was a labor of love that was quite a few years in the making and a massive learning curve on both sides. But on this project, we had 2 Malawian audiology students, Grant Kapalamula and Memory Komera, and 1 USF doctoral student, Kelly Gordy, who worked on the project together. And importantly, we made history. Grant is the first Malawian audiologist to first author a paper. And I think it's important to acknowledge that these projects could not and would not have been possible without our USF colleagues. They were our stats experts, supported us through the data collection process and assisted with publication. My students were really supported by some of the best. And it was also important to me that these students then had an opportunity to present their findings at conferences around the world. So last March, two of my students, now graduates, Alex Dissy and Elnafe Makoka, working on a project with Dr. Toman and Dr. Michelle Arnold, won a travel award to present their project at the Population Hearing Healthcare Conference in Arizona. And with additional funding provided by Dr. Toman through USF's ENT department, it allowed these students to then travel to Florida, where they did 1 week of clinical observations in both the ENT and audiology departments. It was an invaluable experience with an opportunity to see healthcare professionals and services in state-of-the-art hospitals and clinics, and to then bring back that knowledge to Malawi and apply it here. It was incredible. And, you know, they needed to have a little bit of fun and get the true American experience while they were halfway around the world. And most recently, through funding with Kismet, Empowering Health Access, our USF collaborators traveled with recent graduate Ruth Mtamo to South Africa, where she presented her research project on the prevalence of outer and middle ear pathologies at ABC Hearing Clinic. This project, in collaboration with Dr. Toman, Jessie Casanova, and Dr. Abuj Kumar, is currently undergoing the publication process now. And as part of this partnership, it was also important to us that the USF students involved in these projects had an opportunity to visit Malawi and see the impact of their participation. So our USF collaborators brought 2 USF audiology students to Malawi last year. We organized a week-long outreach to the remote areas of Malawi, where patients with ENT conditions had an opportunity to receive treatment from the USF team. And I think what's really interesting is that we, the ABC team, weren't just learning from the USF team. In Malawi, I see so many
It may be that Dr. Vallario has had a brief loss of connectivity. She's going to be right back with us. So in the interim, I'll pick up and discuss a little bit of the slide here. But I believe what Dr. Vallario was going to say is that she sees unbelievable pathology in Malawi. And one thing that I was going to ask her about towards the end, but we'll note right now, is that the ABC graduates are incredibly impressive. You know, I've had the opportunity to work with audiologists from around the world, and the rigorous training program that has been created with African Bible College is truly remarkable. So when we were on exchange and working on outreach with the team, the students truly were teaching you know, many of our very senior people lessons about how to take excellent care of individuals in circumstances where, you know, there's very limited resources. And I think these are valuable and important lessons. So I'm, you know, thinking of some of the specific graduates, Ruth Mtamo, Kamuzu Chiponde, Elnafe Makoka, Alex Dissy, who really are some of the finest audiologists I've had the chance to work with. And, you know, seeing some of the pathology that often wouldn't end up in a clinic, in an audiology clinic in the United States, and might be first, you know, sent to an ENT specialist. Those things are really being managed by Dr. Vallario and her team. And so, Jenna, thank you for joining back on. We actually have a question now about how do providers navigate power outages and Wi-Fi things, and it's a reality of local healthcare. But I was just remarking on how strong the trainees are at ABC Clinic, and really unbelievably, remarkably good at things like, you know, diagnosis, wax management, intervention, you know, in places that you walk in, set up a room. You know, it's not always a very straightforward way to provide care, and yet I think the care delivery is really excellent. So I've got more questions for you towards the end, but I'll let you pick back up where you were.
Okay. Thank you. So we actually have no power right now.
Oh. So how do you navigate power outages with a lot of persistence? We will see how this impacts the rest of our ability to provide for the rest of this presentation. But certainly on my opportunities to work with the team at ABC, this was a reality that at times the power would just go off, and this impacts your ability to teach. It impacts your ability to provide care. You have to be incredibly flexible and understand that you can. I think one of the great lessons is that you can provide really amazing care even when there's sometimes some stumbling blocks. So thanks, Jenna. Are you back with us, Jenna?
Yep. I am. So I did you hear I'm on a hotspotting right now. The generator should kick on campus. Yes. So I'm not going to share my screen until I get Wi-Fi back in my house. I'll just continue talking. Okay. So
I've got 4 questions to go through, or we could also just have you continue to talk, whichever you prefer.
Either one is fine.
Well, since we've got a minute, we do have a couple questions that have come up in the chat already, which is how often are you able to hold outreach clinics in rural areas?
That would depend on funding. We have times where we have a lot of funding and we can send clinicians for weeks at a time. At one point last year, we had a clinician gone for a month in remote areas doing outreach, and recently we did lose a big donor, so we have had to pull back on outreach, but we try to go as much as we can, but it depends on funding. Yeah.
And I do want to circle back to that at the end of the presentation. I know that you've got a few slides specifically for that. The second question is there a plan for the government to include funding education in audiology or hearing health as a part of the health system strengthening policies in Malawi?
So is there funding for education? Is that the question?
Yeah, is the government looking? Yeah, is there a plan in place to sort of provide more sustaining funding for the efforts that you guys are undertaking?
So the government did create 6 positions in 4 central hospitals, and I'll talk about that at the end of the presentation. But we pushed it for a very long time. We, ABC and EARS Inc., and actually the agreement is EARS Incorporated has provided the equipment. They just had to create the jobs. So ideally our MOU with government, which hasn't been finalized, is that we would like to send our students to these hospitals as internships, as training opportunities, and also hopefully have some of those audiologists also come guest lecture for us or help build up our training program. But as far as government funding for education, I don't know if there are plans to have a program within government colleges. I'm not sure. But as far as government hospitals, that has been a pretty significant step as of last month, actually, that they have created 6 positions in 4 central hospitals.
Fantastic. And that actually leads into the third question, which is, what are your current graduates doing? The training is really excellent and rigorous, and your trainees are taking jobs in the UK and other places. But tell us a little bit about what the future looks like for an ABC graduate.
Ooh, that's a really good question. It's a really difficult question to answer as well. We have employed a couple of them in our clinic. We've lost a lot of them to the UK. And yeah, a lot of them are not employed at the moment. They were waiting for government positions to be created. The graduates that didn't get jobs have applied for tech level positions, just getting into government, and hopefully can go up the ladder. Hopefully government creates more jobs, but what we're really hoping for is government creating positions in in district hospitals. So right now they're in 4 central hospital, which is like the big referral government hospitals. But then we have these district hospitals that are in a little bit more remote areas where there is certainly a need. And so our hope, and I've been speaking with another organization about equipment, getting the equipment, pushing government to provide or to create these jobs in the district hospital where that need is there. So hopefully district hospital positions, that would be ideal, but yeah.
And I'll just say the impact on the outreach trips that we took together is really remarkable, and it's a great lesson in what, you know, an individual or a group of individuals can do. So I think, you know, looking at creating these 6 new positions is a massive step forward, and, you know, a really exciting development. But, you know, thinking through what would be the impact of a really well-trained audiologist in a, you know, northern district hospital in Malawi is hard to overstate. So. So I'll
Absolutely.
turn it back to you and let you continue, and then
Okay.
I'll have some questions towards the end.
Okay, should I try to share my screen, or should I do audio only?
Should we try and give it a go and see what happens?
Okay. Are you with me?
Yes, we can see your screen
Okay.
and everything.
All right. So as I was saying, in Malawi, we see so many conditions that I would never see in the US. Things that you learn about in a textbook, but you never see, or conditions that either, like you said, would be managed and treated by ENT specialists before they ever showed up on our doorstep, or just simply don't really exist in the US. Looking into the ear, trying to figure out what you're looking at, only to realize you're looking at the wall of the middle ear space, and fungal infections and drainage that patients have had for 40, 50, 60 years. Or fungal infection so severe that it looks like a cotton ball has been shoved into the ear, and cholesteatomas and complications from HIV or TB treatment or malaria treatment. We are often the first time many of these patients have access to services. And many of these clinics in remote areas just do not have the resources or personnel to effectively treat or manage these conditions. And there are only 2 Malawian ENTs in the entire country. And so you can imagine many of these patients in remote areas either cannot access ENTs in the cities, or if they do have the resources, transportation, ability to get to an ENT, they are often have limited treatment options, or you're added to a very, very, very long waiting list to maybe get some help. So just as we were learning from them, the USF students were certainly learning from us. So how do you build a successful partnership? And maybe this is just a personal opinion, or maybe from experience, but being open-minded and taking the time to understand and respect the culture, its people, and the communities is a really important aspect of building a successful team. And I think this goes both ways. We have so much we can learn from Malawians, like the way they look out for each other and their kindness and patience with foreigners who are oftentimes coming into their world and changing and criticizing and disrupting, and how they hope for the better, and they really love their country. And I think, and I'm not just making this up, I have asked my colleagues things they can learn from us, like our love of protocols and standards, how we advocate for ourselves and for others. We don't beat around the bush, we get right to the point, and of course, the importance of showing up on time and not Malawian time. I personally believe these connections, they happen when we come together from opposite sides of the world with the understanding that we all have something we can learn from each other. Sometimes this happens around a dinner table, or stopping at Lake Malawi after a long outreach day, or when a Malawian proudly shows you how to wear shitinji, which is the traditional piece of cloth worn by a woman. These cultural experiences and our open-mindedness on both sides are so important for the success of international collaborations. And these partnerships are a complex relationship, especially when there is a significant wealth and resource disparity between the 2 entities. This was a new partnership, and for myself and for ABC, it was uncharted territory. I think one thing that really drew me to Dr. Toman was her appreciation and understanding of equity versus equality. She has years of experience doing international work in low-income countries and expertise in public health. I think it's important to acknowledge that people from low-income countries do not start out on the same foot as those in developed countries. From the beginning, our common goal has always been to level the playing field. So many people in Malawi do not have access to basic human rights like clean water, clean air, food security, housing security, medical care, transportation, a quality education. Many students do not have school supplies like pen and paper. So when we partnered, it was important that both sides of the table understood we will do whatever it takes to give my students what they need in order to have equal access to quality education and additional opportunities. And I think that's why we've had the success that we've had. And so why are these international partnerships so important? And not just for research or program development or educational support from USF. Our clinic is funded and supported by organizations who have committed to hearing healthcare in Malawi. As I mentioned earlier, the clinic is a Ministry of Ears Incorporated, and the Australian organization who built the clinic and continues to support it in all aspects. Here, the World Foundation is a Swiss-based organization, and they've sponsored our clinic for many years with equipment donations, hearing aids, outreach expenses, staff support, laptops, calibration costs. We have to fly someone in every year to calibrate our equipment, tuition support. Most recently, we had J&K Wonderland Foundation, another organization in Switzerland who has supported a lot of our outreach expenses as well. School screenings, newborn hearing screenings, and most importantly, the equipment for those 4 central government hospitals, which I'll get back to in a little bit. Medic to Medic, which is a UK organization, they've been providing full tuition support for some of our students. And the last one I'll talk about is Hearing the Call, which is a US nonprofit that we've worked with to provide hearing healthcare in neighboring countries. And they've also provided equipment support and tuition support for one of our students as well. And so these are just to name a few, but I think it's important to acknowledge that our clinic and our college program cannot run without our international sponsors and their support of our program. We also rely on partnerships with local organizations on the ground, such as World Vision and UNICEF, who have helped organize and support outreach efforts, such as identifying kids at risk for suspected hearing loss and then bringing us in and having us evaluate them. One of our most recent school screenings through our partnership with UNICEF resulted in 22 students fit with hearing aids and 2 bone conductor hearing aids. So we really can't do this on our own. And importantly, creating sustainable, accessible hearing care requires government's involvement. Ears Inc. And ABC has been gently nudging government for many years to create positions in government hospitals. Last year, with the assistance of Hearing the Call, we had Zambian Deputy Chief Whip, Honorable Princess Kassoon in Malawi, advocating on our behalf. She was calling government officials, every person she had in her phone book, she was calling, trying to get someone to help create these government jobs. We've been trying for years and we just couldn't do it. There was a little bit of a roadblock and she was making those calls on our behalf. And this is the picture on the left with 2 of our clinicians, Alanane Malili and Blessings Mvula, with the Honorable Kassoon and Malawian Honorable Deputy Speaker. And with their help, as of December 6th, audiology positions in 4 central hospitals have been advertised. They've been filled, and Ears Inc. and J&K Wonderland Foundation has provided the calibrated equipment to those hospitals. And so this moment has been years in the making, and is a very important step for the country as the government now acknowledges the field and recognizes the importance of hearing healthcare. And the picture on the right is the official handover of the equipment to the Honorable Deputy Minister with the Ministry of Health. And that was earlier this month or last month. So what's next? How do we continue to build up audiology in Malawi? We've had a lot to celebrate over the last few years and also a lot of bumps in the road as well. I think it's important that we continue to look to the future And that is, how do you create sustainable hearing healthcare? And that's the question of the day. We're always looking for ways to partner with institutions, organizations, or individual supporters. We look for opportunities to improve and to grow, and ultimately support Malawians whenever possible. And as we look for ways to grow and improve, I think we foreigners should always be asking ourselves if the work we're doing is helping or hurting. And it's not always a straightforward answer, and often I don't know the right answer. Every decision I make, I try to consider the longevity of the program and if it's sustainable. To me, investing Malawians is the single most important thing I can do. I saw the first graduating class of Malawian audiologists in 2021. This year we had another 8. In 2025, 9 more. Our college Malawian faculty team is growing, and I never want to take a job from a Malawian. And there will come a time for that. And it seems sooner rather than later that I will step back and hand it off to my colleagues. And that will be a very happy day for me. And my hope for the program is that Malawians teach Malawians and Malawians care for Malawians, and that, everyone in the country has access to these services. So thank you for having me and giving me the platform to spread awareness about audiology in Malawi and the wonderful work that really my Malawian colleagues are doing, and my students as well. I hope, if you've learned anything from this presentation, I hope the biggest takeaway is that, this kind of work takes a village. Everything I've spoken about, I've learned over the last 5 years. There have been many learning experiences, and I've certainly been humbled quite a few times. But I'm thankful to have a really patient and very kind Malawian team. And they are truly the reason that we've had the success that we've had. And I'm a small part of this much larger team. So thank you for having me. And before I wrap it up, I would just like to say the names of my colleagues because they deserve all of the recognition and the praise. So from right to left, we have Blessings Mbula. He's an audiologist currently studying at the University of Pretoria for his master's. He'll be joining the college team soon. We have Kamuzi Chiponde. He's an audiologist and college lecturer. Myself, then Alex Dissy, audiologist, class of 2023. Alanane Malili, she's an audiologist and the head of our department at the college, who I cannot say enough good things about. Ruben Kapanga, he's our administrative assistant. Ruth Mtamo, our audiologist, class of 2023, and expat volunteers, Charmaine Hill, our new clinic manager, and Lawrence Hill, audiologist and college lecturer. And not pictured, our clinic and program founders, Peter and Rebecca Bartlett, who are still very much involved in supporting and managing the clinic from afar in Australia. And a quick plug, because I take every opportunity I can to source funds for our clinic and my students and our outreach services. If you are interested in supporting audiology in Malawi, you can visit africanbiblecolleges.com. ABC is a U.S. nonprofit and a 501c3, and all donations are tax deductible. So thank you for having me. Please feel free to reach out to me. I'm always open to comments, questions, concerns. I would love to hear from you. So thank you very much.
Dr. Laura, I remain incredibly inspired by what ABC here and you and the team have been doing and what you built. I mean, this is one of the more remarkable examples of success, I think, in taking something from the ground up to a training program that is incredibly rigorous and is changing lives in ways that you can see every single day. So really appreciate your time and expertise. We have a few questions. I want to jump in and ask a very specific question, though. We had a chance to go on outreach together for a week with the whole team, and I wanted to just get a sense of how, as we're thinking about things like donations and we're thinking about impact across the nation, how many patients are you reaching in a week, and how much does funding a week of outreach cost for the clinic, and what might a donation of a certain amount actually do in terms of reaching people in need? As the power
That
comes
would be the
back
power. That would be the power coming back on. So my computer might switch over to my Wi-Fi. So if you lose me for a second, I'll come back.
on.
Yeah, I mean, a little bit goes a really long way. You know, if we publicize correctly and we make sure that, you know, the community knows we're coming, hundreds of people show up. People, you know, travel days to see us because otherwise, you know, there are no services in their area. So, you know, $500 to $1,000 easily could fund, you know, a few clinicians to go out on week-long outreaches to these remote areas. Of course, it depends how far we're going. Fuel, we've had just last month, in the last couple months, we had actually a devaluation of 40% of the Malawian kwacha. So, you know, everything is getting more expensive, but you know, $500, $1,000, it goes so far and it impacts hundreds of people. And so, you know, there's no amount too small. Never. It adds up and it allows us to do these free services.
And as we've discussed, you know, that covers, you know, petrol for the car, maintenance, supplies, antibiotics, lodging for the clinicians, pay for the clinicians. I mean, it's amazing how far that money can go. Something else that I will say that you might not say on here, but you volunteer. You are not a paid employee. You do this as a volunteer. And
I
that's
love
a
what I do.
remarkable thing, but it shows how much how much you have personally invested in this, and it truly is inspiring. So there are a couple of other quick questions, and then we've got a couple minutes to finish up. The one is sort of what is ABC's long-term vision for hearing health in Malawi? And you touched on this a bit, but maybe give us a few extra thoughts about the long-term vision for hearing health.
For ABC Hearing Clinic or for the training program?
Maybe both. Give us a little bit of both.
Yeah, I mean, right now we're still, you know, we're a small facility. We have, you know, 2 assessment rooms, 1 hearing aid fitting room. I mean, there's only so much you can do with limited number of rooms. And so, you know, my hope is that we continue to grow. And if we can grow our facilities at the hearing clinic, we can grow in the number of students we take. We are really limited on the number of students we can take in our training program because audiology is practical, it's clinical. They need hands-on training in the clinic. And there's only so many rooms for that and so many clinicians. So you know, the goal is to continue to grow, to expand the clinic, which means we can, you know, increase the number of students training, and increase the amount of funding we have to provide more services to the community as well.
Another question that we have is highlights the importance of research and describing the sort of burden of disease. But what are some future research topics that you would like to see embarked upon?
We've done quite a bit of research in the clinic. I would really love to look at some outreach data. I think so there's a pretty significant difference in the population that we see in the clinic versus on outreach. In the clinic, you know, people pay for services. It is a private clinic, so people have resources, and that's just, you know, the disease burden we see in that population versus the outreach remote communities is very different. And so I would love to look at some outreach data, and because I think we'll have totally different findings.
Mm-hmm. Well, I just have to say what an incredible pleasure it's been to have you on, and on behalf of USF Health International and our attendees today, truly thank you for everything that you do and for taking the time to tell your story. Zikomo Kwambili, and please.
Oh, Zikomo. Tio Nana, Zikomo.
But please pass, you know, all of our regards to the rest of the team, and we hope to catch up with you again sometime in the near future.
Absolutely. Thank you so much.
All right. Thank you, Dr. Vallario.